I was told by two completely separate doctors from two completely separate organisations saying that they're actually now going to buy their own equipment because they are so worried about not getting it out, getting the right equipment. And part of the problem is some of the messaging from Public Health England, which changed about sort of what type of masks you need in which type of wards, and it's led to a degree of confusion. But the fact is they do not think they're getting enough equipment in there to protect them. Now, today, we received an audio message from a consultant on the front line. Their words have been revoiced to protect their anonymity.
I'm recording this because I'm incredibly concerned. I'm a doctor on the front line of one of the major hospitals in London, and we are now accepting multiple patients who are COVID positive. Unfortunately, despite much planning and attempts to try and get ourselves ready for dealing with these patients, and protecting ourselves and our healthcare workers, as we try and manage these patients, we're having lots and lots of difficulty sourcing the right equipment. We have staff on COVID wards who've been seeing COVID patients who are entirely unprotected. They do not have the right equipment, and they're being told by senior management that that's okay. We keep trying to get people at a higher level to listen to us, and we're being told that there are supplies, but the supplies never reach the front line, and I hear this from multiple hospitals all over the country. So this is a crisis, and this is one that needs to be addressed by the government, and we need to have the right protective equipment. Our staff are scared, they're panicked. We have multiple members of staff who are already unwell and leaving the rota. We're having to purchase equipment ourselves, and we're receiving many mixed messages as to what's important to us in terms of protecting us.
That is really upsetting to hear that. And there is also the issue of testing. And again, we heard Matt Hancock, the Health Secretary, talking about this. But the fact is it's still only being done on the critically ill, those who have pneumonia or who are suspected of having pneumonia, who are being admitted to hospital. And the third category is for care homes, because they've always thought there might be clusters there. Yet today, on the South Coast, we have learned of one care home where the disease appears to have spread because the testing was too slow. There are 20 residents at this Oakland's nursing home in Hove. 14 are now showing symptoms of COVID-19, along with 7 of the 28 staff. But we have now learned that it took 10 days for Public Health England to test anybody.
We don't know because none of the tests have been confirmed yet. But the point is that these are elderly, these are vulnerable people, and it should never, ever take 10 days to get the test done in the first place. And now they are still waiting for the results.
We also understand the manager of the home has asked for hospital-style personal protection equipment, PPE, but has been told they are being kept for hospitals.
The system should have responded in a way that could have actually avoided this situation spreading within one care home. It really shows at the moment that we have to up our game if we're going to get it right for these most vulnerable people.
We asked Public Health England why it took so long to test, but have not yet had a response.
We have a simple message for all countries: test, test, test.
50,000 tests have been carried out in the UK so far, and the plan is to increase this to 25,000 daily. Currently, it's a fifth of that. But no healthcare workers are being tested, nor the general population. Public Health England is asking for submissions to evaluate self-testing kits similar to this for reliability, but they have not told us when or how this is happening. Yet Spain has now imported 640,000 testing kits from China and South Korea. We have seen letters now from NHS consultants and leading epidemiologists to the Department of Health and to the UK government asking for this general population testing to happen here now.
The NHS does cervical screening by testing for HPV now. You can use those machines for the test. And so every machine should stop what it's doing. And just for 3 or 4 weeks, quite a short time, run these tests. And at the same time, you've got to put out an appeal or an instruction to the British biotech industry to produce reagents that are needed as fast as possible. I mean, and the NHS can very easily produce the labelled tubes and put them in envelopes to the right address.
Swab tests like the one Professor Petto is talking about here, which are reliable, or self-testing kits using blood samples. Either way, there is an urgency to this. And the Financial Times today reported that the UK government is in talks with the likes of Amazon to deliver any kits to homes and healthcare staff when they are available. For those who are most vulnerable, text messages went out today telling them that they now need to remain inside for 12 weeks. They can open a window but not leave home, and they must stay 3 steps away from other people. And there was this stark video released by the Belfast Trust.
This is the crucial time. This is not a rehearsal. You will only have one chance at this. Stay at home.
The concern is not just for overwhelmed hospitals, but for the patients and the staff.
Well, now, following government guidelines, I am practicing social distancing and I'm working from home. Now, a short time ago, I spoke to Dr. Jenny Vaughn, a leading member of the Doctors Association, who have written to the government to demand better personal protective equipment for medical staff. So I started by asking her whether the PPE equipment promised by the government was actually starting to reach the medical staff on the front line, and what kinds of problems medical personnel had been encountering.
There have been stories of doctors and paramedics having to go to Screwfix, one of our local retailers, to find themselves masks. And, you know, these are the kind of things that shouldn't be happening in they're all very highly stressed at the moment, as you can imagine, John. So that's why we felt the need to write this letter. Over 8,000 frontline doctors have signed it, and senior doctors and medical directors have signed it. We felt that we needed to re-emphasise to Boris that this should be his #1 priority, because if you can't look after the front line, the health front line, then everything is compromised in the system, and we must keep them going as a priority.
Dr. Vaughan, the other issue that has been raised is, are these masks, is this PPE actually up to snuff? Is it what is required?
Well, that's a very good question, John, because it's been a source of confusion. Because up until 2 weeks ago, people were gowning up, and they were wearing visors, and they had what appeared to them to be greater protection. They also look around the world and they look at the WHO guidelines, and there seems to be a bit of a significant discordance between being asked to wear a surgical mask, an apron and a pair of gloves, and a visor and a full gown. Now the advice seems to have changed, and they're saying, no, it's perfectly all right to wear just a surgical mask and an apron, unless you are doing what we call aerosol generating procedures. So you're actually, at high risk of exposure to the respiratory droplets. Now, we would like urgent clarification.
Well, now, the other big issue is tests. And the question is, A, whether there's enough equipment to test people, B, whether there's enough testing going on anyway. I mean, aren't too many patients coming through the hospital system and never actually knowing whether they had it or they didn't?
We understand that they're complex testing, but what we're looking at here, John, is that on the front line, we have 2 main problems. If you have symptoms and you are a doctor or a nurse and you have to go off work and wait for a test, you are actually not being able to look after patients, and you could be infecting your family. You want to know as soon as possible that test is negative so that you can get back to the front line. If it's positive, you want to take the right precautions and not infect your family. Doctors of families, there are stories from the front line of doctors living in mobile homes at the moment, or living in mobile homes because they're the ones who are looking after COVID patients every day, and they don't want to infect their families. There is an extraordinary amount of sacrifice here. All we're asking the government to do is give an absolute priority to healthcare workers in this testing and get it to them so that they can know either way, for the sake of their families and for the sake of their patient, because of course it's a patient safety issue as well.
Dr. Jenny Vaughn of the Doctors Association talking to me earlier from Westminster. Well, now, we want to keep you regularly informed with all the facts that you need about the virus. So here's a reminder of what COVID-19 is and how it might affect you. Like many respiratory viruses, COVID-19 is spread by tiny droplets that come from the coughs and sneezes of an infected person. As doctors and scientists study exactly how the virus behaves, here is a short guide on the symptoms to look out for. We know that most patients get a fever. The NHS advises that you don't need to take your temperature. Just being hot to the touch on your chest or back is a symptom. A new and continuous cough and shortness of breath. A few people get diarrhea, nausea, or a runny nose. There's also evidence from around the world that a significant number of patients experience a loss of smell or taste, even in mild cases, and where people don't show other signs of the virus.
Well, amid the rising concern about society's most vulnerable, food banks have asked supermarkets to set aside supplies, including online delivery slots for charities. Some stores have already donated millions of pounds to food bank charities like Fair Share and the Trussell Trust. But how are people reliant on such essential help managing to cope so far? Our Home Affairs correspondent Darshna Soni reports.
So usually all of this would be full with tinned items and dried goods. There's no more than about 20 food parcels stock in the food bank, and we've got 32 referrals to do.
Sajid Mohammed is desperately trying to keep his food bank open. He founded it nearly a decade ago, and along with his volunteers has helped hundreds of people across Nottingham. But the coronavirus outbreak has seen donations dwindle.
What we've seen over the last 14 days is people hoarding food and not donating. By not having the food is giving me anxiety, the staff, the volunteers, knowing that there could be 50 families within this neighbourhood starving because they haven't got any food.
The food bank is in an area called Hyson Green, a busy, bustling community, but also the 8th most deprived area in the country. More than half of all children in this ward are living in poverty.
This crisis has brought inequality into sharp focus, and there's likely to be a huge impact on hunger. Around 14 million Britons are living in poverty. Half of them are in work, and yet their jobs are most at risk. Already, many have been told to take unpaid leave, to reduce their hours, or have even been laid off altogether, making them more vulnerable.
You'd be amazed which people are using the food bank. You know, all different backgrounds, different educational levels, but just hit crisis in their lives.
And as more and more people are likely to hit crisis, the pandemic has exposed the fragility of our welfare system.
It could be financial, going on to universal credit.
For those who find themselves on universal credit, there's still a 5-week wait, something food bank providers want the government to scrap.
Hello. Hiya, Chris. We're outside on the main door. Can you come here and collect it, please?
Yeah, I'm coming.
Wicked.
That's how Chris Bailey ended up relying on donations.
Well, my partner recently died July last year.
Oh no, I'm so sorry to hear that.
Yeah, well, because of that, I had to downsize because I couldn't afford the rent. Then I went on to universal credit, and that's where the problem began.
Chris had been working in catering until he stopped to nurse his wife through her cancer. In the last few days, he's watched on as people have stripped supplies from the local shops.
And when you see people going mad in the shops for the food, what do you think?
Well, I think I wish I could do that myself, but obviously I can't. It's actually a life-saving bag of food there, really.
The government says it has announced measures to strengthen the safety net for people in these unparalleled times, including a £500 million hardship fund for local councils. For Sajid Mohammed, there's a moral responsibility for us all to look out for those most in need.
When I see people stockpiling, I get very angry and upset because I know that means a child, an elderly person, is probably going to go hungry.
A number of food banks have already taken the difficult decision to close their doors. In West Yorkshire, the police are investigating after this food bank was broken into, its shelves stripped bare of everything, including the toilet roll. Mr. Mohammed and his team hope to carry on for as long as possible, keeping faith that these uncertain times will bring out the best in our behaviour as well as the worst.
We all need to work together and just think about our actions, think about the consequences. If we all work together, there'll be plenty of food for everyone.